This is Stephanie Henderson doing my patient teaching on ranitidine, acetaminophen, and amoxicillin. We're going to start with ranitidine. This is being used for your GERD. You're going to want to take this medication before meals. It is going to decrease your acid production. Some side effects of this medication may include headache, dizziness, nausea, vomiting, diarrhea and constipation, abdominal pain. You are going to want to report any abdominal pain or any pains, period, or any coughing or vomiting of blood. This is a medication that can cause blood disorders. With this medication, you're also going to want to alert the doctor if you have any renal or liver impairment. If you're breastfeeding, these are contraindications with this medication. While you're taking this medication, you should avoid foods that are high in caffeine, food and beverages that are high in caffeine, alcohol-containing products, any spices, and things that can irritate your stomach. And be sure to eat foods and consume foods that are rich in B12. That is going to increase the therapeutic level of this medication. With this medication, when you're first starting off, we advise you and ask to not drive or to do anything that could be perceived as a dangerous activity until you are at least stabilized on the medication. And then from there, you can go from there, but just until you get stabilized with this medication. The next medication that we're going to talk about is acetaminophen. This is also known as Tylenol. This is a medication that's taken by mouth, and it is an as-needed medication for mild to moderate pain. Okay, this medication, it is very important that you follow the dosage instructions on this medication. This medication can be toxic to your liver if too much of it is ingested. So 4 grams a day should be the maximum that you are taking for this medication. With that medication, you're also going to want to avoid alcohol, because alcohol is also toxic, can also be toxic to your liver as well. Some symptoms of liver disease could be nausea, vomiting, abdominal pain. So just be on the lookout for those symptoms and report if necessary. Other symptoms of the medication alone may be constipation, insomnia, decreased appetite. Okay. If you're finding that you have to self-medicate for more than 10 days, please be sure to let your provider know this. Okay. There may be other measures that need to be taken to be able to control your pain. Caffeine may increase the effects. Oral contraceptives and antacid may decrease the effects. So just something to keep in mind. This medication is not an anti-inflammatory or used for those purposes, so please don't use those for those purposes. This medication is for pain relief and can also be used to reduce fever, reduce temperature. The last medication that we're going to talk about that you're taking is amoxicillin. Amoxicillin is an oral antibiotic that is taken by mouth. This medication, the whole medication regimen should be completed. Even when your symptoms start to improve, you need to continue all of the medication until there are no more medications left. This medication can cause GI distress, like nausea or vomiting. So you may want to go ahead and take it with food, and that can help alleviate some of those symptoms. Also, you want to maintain good oral hygiene, because this medication can cause teeth and tongue discoloration, so you're definitely going to want to maintain good oral hygiene. Headache, dizziness. Also, too, this is an antibiotic, so it is possible, not that it's going to happen, but it's possible that a super infection could happen, which is another infection on top of this. So you're going to want to watch for signs and symptoms of a super infection, which may include genital or vaginal discharge, genital, anal itching, mouth sores. These are all signs and symptoms of a super infection. You're going to want to contact your primary care provider, as well as signs and symptoms of Stevens-Johnson syndrome, which could include blisters or rashes on your skin or around the mucous membranes or around your mucous membranes. That's a symptom of Stevens-Johnson syndrome. So you're going to want to make sure that you watch out for those and report those to your primary care or to your primary care physician. Or the prescriber of these medications. Also, too, while taking this medication, you're going to want to avoid acidic fruits and juices that can decrease the effect. Thank you. That is my presentation.